This is the platform where we have a 360 discussion on corporate social responsibility as well as sustainability. Welcome once again, and this is CSR Lens. If you want to be part of this conversation, or you want your friends to be part of the conversation, just share the link and be able to, so that we can get other people to be part of the conversation. You can also send in your comments, because today we have one interesting lady who will be sharing a lot of things with us. So over the years, a couple of organizations, or lots of organizations, run out corporate social responsibility projects. But the question that I keep asking on this show is how sustainable these projects are. Do we just come up with a project, an idea, and just run with it, or we think through the level of sustainability over the period, even when we are out of the communities in which we find ourselves? Today, to help me have a discussion on self-reliance, the story of Engage Now Africa, is the country director of Engage Now Africa, Madam Cecilia Amankwa, who will be helping me to have a discussion on what the role of Engage Now Africa has been over the years in terms of self-reliance, and what exactly Engage Now Africa is engaged in. All right, so good afternoon and welcome to CSR Lense.
Good afternoon.
Good to see you.
Thank you for having me.
All right, Engage Now Africa. Now, before we start the conversation on Engage Now Africa, let me find out from you personally, how did development work start for you? Where did the interest stem from?
Wow, that's a nice question. You know, I grew up in a community where I've seen my mom, my grandmom, my grandpa's busy at work, and probably what piqued my interest more in doing what I do is the way they give, the way they impact even the little that they have to the people around them. Yeah. So I kind of enjoy not only the impact of what they give to the society or the people around them, but the fulfillment of what they get from doing that. See them very happy when they're able to help someone. And I said, oh, this is a good thing to help makes you fulfilled. So let me also try to do the same. So probably that's where the interest started from. It started from what I've seen my parents and my grandparents doing. Yeah, and it's all about passion, you know. If you're doing something and you have passion for it, to do it right. If you are being forced to do it, you don't get the results for it. So I think that's what I got my passion from.
There are people who have particular interests, so even within development, they're looking at education, or they're looking at service projects of a kind. It could be maybe teaching people skills, or anything. Do you have any particular interest when it comes to development?
Of course I do. Like, you know, we all have skills and kind of something that we believe in, but probably I believe more in helping masses, you know, like try as much as I can to impart knowledge to people around me and to impart even the little resources that I have. I love to share what I have. And probably that's what's brought me this far in what I do. So with the skills, yes, but I love teaching people what they should do, but more so especially, you know, we all have our different skills or whatever it is. So I can't force my skill on you. I can find out from you what you can do, and if I have help to help you to develop it, then if I can, then I will help you to do that. I love skills. I love people kind of developing their skills and putting it to good use.
Now let's talk about Engage Now Africa. You are the country director for this organization. What exactly are you into? What do you do as a country director for Engage Now Africa?
Okay, so Engage Now Africa, for your audience, is an international NGO operating in 5 African countries. And we are currently in Ethiopia, Namibia, Ghana, Sierra Leone, and Uganda. In all these 5 countries, we have our different kind of projects or programs that we undertake. And our main mission is to heal, to rescue, and to lift individuals, families, communities. We just want to help people to lead them out of poverty. Okay. That is our main mission. But under this heal, rescue, lift, we have programs that we undertake under them. If you don't mind,
sure.
I mean, one.
Yes, we would want to know what entails the healing, what entails the rescuing, and the lift.
Okay, so let me take the healing first.
Okay.
So with the healing, we are more into clean water wells, because most of these are communities, especially in the northern part of Ghana, have issues with water. So engage now Africa, knowing the needs, because one thing that you also have to know is that we don't just walk into a community to impose our programs or projects on them. What we do is we meet with the opinion leaders, the community, we have Peace Corps coming to us, and all the assemblymen, the chiefs, and all these people. We meet with them, and then we kind of talk about their issues, and together we come to a conclusion or to know exactly what they want so that we can help them to do. In doing so, we believe in the asset-based development program approach, and we believe in engaging the community in everything that we do, because we want them to own the program after we are done. Okay. We don't want to go back, or when we are gone, then the program is dead. We want the program to continue to help them improve their lives. So that's what we do. We engage the community. Community involvement is very, very important to us, so that we can sustain the program. I know we are not sustaining it, but that is what we do as an organization. So when we come to the healing parts of Engage Now Africa, Engage Now Africa, we have, like we have the clean water wells that I said. We have it drilled in almost all, but mostly in the northern part of Ghana. We drill over 80 boreholes in the northern region alone. And we also have our health and sensitization program. So we kind of sensitize people on maybe community health, how to take care of their environment, how to keep their water bodies clean, and just have to make sure that they are healthy, so that they don't spend so much money on hospitals and invest that money in the children's school fees. And we also look at maybe medical services. So, like I said, most of these projects are done more in other countries than the other. Medical services, I will say that in Sierra Leone we have a clinic. Engage Now Africa has a whole clinic providing medical services for lactating mothers, for children under 5, and for serving the community. Especially the hospital is based in Bo. Bo is one of their districts in Sierra Leone. So you can see a whole hospital set up to serve the community. But in Ghana, as and when we have individual cases that families cannot help or afford to pay for the medical bills, Engage Now Africa kind of come in, and then we meet them halfway, talk to the hospital that is taking care of the patients, and to see how best we can help with the bills or whatever we can do to support the person.
So with the background you've given, even though you are an international organization, your projects are community, country-based, because there are different needs in these countries.
Exactly.
Okay. Now let's talk about the rescue. Okay. Who are you rescuing?
Wow. Well, rescue, it's good you ask that question. Who are we rescuing? We are rescuing everybody. We are rescuing people that are ignorant of the law. We are rescuing people that, because of poverty, they are kind of giving out their children or themselves to slave masters. So in this modern age and time, if I tell you that we still have slavery going on, we do believe it? We do. And so this time they have a modern type of slavery, so we call it modern slavery. We have people, we have children being forced into labor, we have children being kind of sold to people to go and fish in these fishing communities. We have even young ladies that are sold into prostitution or something to other parts of the country or even in our own country. You know, it's a very serious issue that people do not really know if this is really going on. So Engage Now Africa, we've taken upon ourselves to deal with two sections of that. There's a lot in the End Modern Slavery department, but we want to focus on two sessions. We want to focus on the prevention and education part and partnership. Yeah. So we go to the community. So these communities, if we said, definitely in the course of implementing our programs, you will come across cases like that. So we have that department so that when we kind of sense or see something like that, they will quickly go in to kind of sensitize the community, train them about the tactics that these people are using to get children and whatever it is to slavery.
So which communities is this happening in Ghana? And which communities are you working with?
Oh, yes.
Okay. Which communities are you working with so far?
Actually, we are in 10 out of the 10, 10 out of the 16 regions.
Okay.
Yeah, so we are in quite a lot of communities. Yeah. So, but mostly what I'm saying when it comes to child labor, it's about 70% of this child labor is being done more at the coastal areas, you know, especially like Georgia, where we have the water lake, where we have the sea, the fishing communities. So they kind of, you know, they go to the villages, they kind of say, oh, let me take your child to school. Let your child come and stay, because you are not able to even feel that child in the first place. So you may have to give that child out for somebody to take care of him or her for you. Yeah. But you don't know if truly this child is going to be taken care of. You know, and they bring these children from their villages or from their parents and they enslave them into doing hard work and things that are not even necessary.
You talk about prevention. I know that when you go into details, I mean, for you as a development person, there is a cost route to these things. I mean, it could be the parents of these kids not even having a means of economic means, and so they push these kids into that. There are people who have actually set up, this is more like a job for them, and so they make money out of selling or pushing these kids into these kinds of things. What have you identified as a cost route of this, and how are you working on the prevention strategies?
Thank you. So what we have identified is poverty. Okay. Poverty is the number one cause of trafficking and slavery. And then the second one is culture. You know, the culture also orientation also kind of, you know, allow you to take my child to come and stay with you, as to whether you are taking good care of him or I don't know. And ignorance is also known, because if I don't know if truly what I'm doing or giving my child out is the right thing to do, I just kind of do. So these are the three main things we have come to understand that are being the cause roots of human trafficking or of body slavery in this area. So knowing this, we try as much as we can through our prevention model to educate and create awareness and sensitization programs. And also sometimes when I talk about poverty, like you said, most of these women, especially women, are the most vulnerable people when it comes to such things. We kind of assess their means, what they can do, and that is when the skills and things comes in. What can you do? What can you sell then we enroll you into one of our programs, either the adult literacy, the vocational skills program, and then we kind of give you a startup capital so that we'll be able to set you up in a way that you'll be able to fund to take care of your children so they don't get to be trafficked.
Okay. Yeah. How has the response been for you? Because the issue of cultural orientation is something very difficult to deal with. I mean, these are people who do not even see anything wrong with the things that they do. So sometimes when you are tackling issues or problems within that area, it's very difficult. How have you handled it over the period?
Oh, okay. Well, we engage the community leaders.
Of course, you are engaged.
Of course, we engage. So we don't just go and tell you what to do. We kind of, mostly what we do in these communities are to get the opinion leaders. You know, you have to get somebody that the people listen to. Somebody that when he or she talks, the people want to believe that, okay, what this person, he or she is our leader. So what they are saying is right. Let's just, so those are the kind of people you have to work through with. And because, number one, they even understand the people better than the do. Remember, we have language barriers and stuff. Aside having cultural differences, we have language barriers. So you want to make sure that whatever you are communicating is going down well, and people are trying to understand what you are trying to say. And so it's very necessary that you work with the leaders that the people listen to get your message across. Otherwise, you can't do anything right.
Great. Now, is that all that you do on the rescue? Is to say, is it
more or less, yeah, more or less just like it. We don't do so much, but as and when we have cases like maybe persecution and all of that, we kind of, but we are more into prevention, education, and partnership. We partner with like-minded NGOs that are also doing that to make sure that we get a comprehensive materials and also information to get to the right people.
Now, we were in this country when an 89-year-old or 90-year-old woman was lynched to death because they claimed she's a witch. Do you do anything in that area under your rescue program?
Wow. Yeah, so just recently we had this that kind of, well, he's not even there, which is okay. But he kind of bring people, children from the village, to come to the mosque. So they are helping him to put up a mosque. Unfortunately, he's molesting some of these girls. And the case has been reported to us. And in a way, we kind of, so if we get to know this is what is going on, quickly, we come with our partners to, before we don't go in all alone, you need the police, you need also, you need social welfare, all these people who have to come together to be able to get a good job done. So we have to get their attention to make sure that, unfortunately, we are able to have him arrested, attached to the fact that truly he's not what he did. He was prosecuted. So I think justice for once is served. Yeah, so if we know, we will come in, but not when so the person died. But if the case is brought to our attention, then we'll do something about it. Okay. Yeah.
Lifting. It is one of the things I love to do. And I mean, all of us need someone to lift. And so when I saw that your mission is to heal, rescue, and lift, and of course you talk about the healing, the rescuing, how are you lifting people?
You know, you asked me a question how I enjoy doing this work, right? Yeah. And if I'm not lifted, probably I wouldn't be doing what I'm doing. So I also want to lift others along. So how we are lifting as an organization is what I will be telling you.
Of course.
Yeah, so under the lift, we have a couple of programs too that we run. You started with this program saying that you want people to become self-reliant. Engage Now Africa is all about that. We want to end poverty. We want people to be able to provide for themselves. We want people to be able to belong in society. So we believe that if we are able to train you to become self-reliant or to help you to become that, then you'll be able to help others too, just like I have been helped. So we do that. And then secondly, we do this through the programs that you run. So we have a robust adult literacy program that women and men that do not have the privilege of going to school can also come to the class to learn how to read and write basic English, speak, and also how to do just basic arithmetic to be able to calculate. And to surprise you, we have over 8,000 people passing through this program, and some are still in the program. Wow, yeah. So through that, it's kind of helping people to really feel like, oh, now I can do this. Now I can do that. Because it's not only reading and writing, it teaches so many things in the process. Right after that, we come to our business and business and financial empowerment. Yeah. So when we are done with our adult literacy and you are able to just do some basic reading and writing, we now come to the business, financial empowerment side. You are trained on how to manage your own business, how to take care of the family, how to even save for the business, even if you want to apply loan, how you can prepare your business plan to be able to apply loan to create your businesses. We take them through all this. Right after that, we enroll them again, those that want to enroll them again into the vocational skills program. So we have a vocational skills program as well, and in that aspect, we train them on hand sanitizer.
I was coming to that. I've seen a couple of things on the table. Yeah. Very beautiful things. Yeah. You have hand sanitizers. Yeah. Did you start this when COVID?
Exactly. Okay. Exactly. So this wasn't part of our program for the vocational skills.
So it's one of our response to COVID.
Exactly. And if I tell you the number of lives we have impacted by producing this, you'll be surprised. Because people have been taught how to do it and do it right. People are selling it and they are making money out of it to feed or take care of their families. And we also teach them, this is liquid soap. Okay. How to prepare your own liquid soap. So this is, I'll talk about the albinism program. This is like a sunscreen for persons with albinism. But it's not only for persons with albinism. If you need a sunscreen, a good sunscreen, anybody at all can use this. Exactly. So we have a lot, and if you can see on the table,
the
fabrics, we protein tie-dye, batik, we have a whole lot of things that, and we put shampoo, conditioner, just name the basic things that will not cost you so much money to do. So these are the kind of skills we are into, and even more.
Are you able to tell us how many people have gone through this training?
Yes. Yes. So out of the 3,000 that graduated, we actually started the vocational skills in 2018.
Okay.
So right now we have 1,007 plus people who have gone through the vocational skills program. So over 1,700 people have benefited from our vocational skills program. And we've been able to do this successfully with partners, because we have partners that are also interested and they love what we do. So they kind of partner with us to be able to impact more lives in what we do.
Now, I know that a lot of the time when organizations set up in Accra, a lot of concentration is given to Accra and the urban areas. I don't know why, but is that the case of Engage Now Africa? Because I know that there are people in so many areas who need some of these things to support their livelihood.
It's the opposite.
Okay.
It's the opposite. We are more in the rural communities than urban areas. It's the opposite, because we are more into the vulnerable.
But that is not to say that we should forget about.
Okay, we are more than here. Accra is still Accra. Yeah. You know, we are all here, we are coming, but we feel like we have to take this program to the marginalized. We have to take it to the vulnerable. We have to take this to people that really need it. So we try as much as we can to get our programs out there. To be very, very honest with you, all of us here are not kind of office persons. Okay. We are always on the field. I believe strongly that whatever you are doing, if you want it to be successful, you have to be part of it. You have to be part of it. We talk about monitoring and evaluation. Fine, you might have somebody to do that for you, but if you want to really see that the job is done right, be part of the job. So that's what we do. We are more or less like field workers. We don't sit in the office attending meetings and conferences, and we don't really eating and drinking tea. No, unfortunately, engage now Africa is not about that. We are more about the work and working with the people. So we are more on the field working with these people.
Now, you've set some targets for yourself, but before we even go there, let's talk about your health programs. What exactly are you doing in the health program? I know you talked about the mothers, the maternal interest for the mothers, but that is really running in other countries. But in Ghana, what kind of health program are you running at the moment? And I'm asking this because, of course, we are in a health crisis, and so a lot of people are looking up to organizations that are supporting in the health area, and what kind of support you can even reach out to these organizations to get. So when it comes to that, what kind of areas are you looking at?
Okay, so well, with the health area, like I said, each country with what they do best because they have the facility to run that. When it comes to Ghana, we, through our vocational skills program, have partnered with some institutions. Okay. So during the COVID era, we partnered with Ensign College of Public Health. Okay. It's a health university that it's more of health issues. So we want to partner with people that really understand what the situation is, so that we'll be able to impact well to people's life. So we partner with Ensign College, and we've been able to come up with material so that we did assessments to assess what the problems. But we are, like I said, we are more of the rural communities. So we kind of go there more to assess how do they understand what this whole COVID is, what are they doing to prevent themselves, what can they do to protect themselves. So after that, after our findings, we now know what we have to do. So we take in the education, so we come up with education materials to be able to go and train them and let them know, illustrate what the whole thing is all about. And we also went through some PPEs as well. So we don't have to kind of buy them because we already have a program that can produce. So we have, so these are what we do. We kind of engage our members to come in, learn how to do it, and then produce to us over pallets. So the students came around, we taught them how to produce hand sanitizer and face masks and all of that. We even taught them in their classes how to even knit their own face masks. So that we have people that do not even have money to afford it. So even if you have a handkerchief or a cloth that you think you might not need, bring it. We teach you how to use just a needle and thread to knit one for yourself. We did that with most of our classes, and they were so excited, and they took it very seriously because this virus is not only a virus that we should take lightly or we should just leave ourselves right after the virus is over, then that is it. I'm sure this kind of is a wake-up call for us to take ourselves very seriously, especially when it comes to hygiene. We have to take ourselves very seriously and make sure our surroundings, what we eat is very, very important. How clean, how nutritious, how good, everything counts. So we just take the opportunity to let them know that even if this virus is over, you have to stick to the protocols. Stick to it that you will be able to take care of yourself and your family. So we kind of.
I see. Now, training is good. So I'm coming to how to get the people to even market the items that they're being trained to produce. What has been the response in that area? Because I know that there are certain people who learn the skills and produce it, but then the skills to market and get the money out of it is also a challenge. Do you have any program with regard to that? People who teach marketing skills?
Yeah, so that's why we have the business and then the financial empowerment program. So that is for you are being trained or you are being taught how to market your product. Okay, so even before then, you have to really know what you are good at. You don't just wake up to produce a product because somebody is producing it. What can you really do and do it very well? That will be different from what the other person is producing.
So are they given the chance to choose?
Of course, they are given the chance. So that's why we engage them before the training is done. We don't just say, okay, so this is what you have, so come and do it. No, we will engage you, and then you tell us what you want to do, and then we give you that skill. Then we make sure that you put it to good use as well. But we have some people that have, maybe they have their shops, they have provision shops. We have countless stories that are producing some of these things and selling. We have a woman joining this program. Fortunately, she's managing a hotel for the uncle. She started producing liquid soap and selling at the hotel. And she's selling, she's just making big time business. And she's supplying to others. Others will come, take it and go and sell it, they'll come and make the sales to them. You see how impactful that can be. Yeah, so that is what we need. Those that do not even have the means to do, we kind of even train them to come together as a group. And then we see how best we can also help them to start producing a particular product. You can learn so many products, but you have to specialize in one or two that you are very good at, so that you'll be able to, use or do something good out of it.
Yeah. All right. Now, let's move on to the targets you set for yourself as Engage Now Africa. I know that listening to you, it seems, and let me play the devil's advocate here. It seems you have impacted a lot of people. Are you able to tell us the number of people you have so far touched, you've so far healed, you've so far rescued and lifted?
So we've set a target to impact 5 million lives in 2021.
Wow.
By 2021,
5 million?
Yes, by 2021, we should impact 5 million lives. Just so you know, Engage Now Africa started 2002 in Ethiopia and 2006 in Ghana, so 16 years ago in Ghana and the other countries, as well. So and this 5 million is not only for Ghana, it's cut across the various countries we operate. So currently, we are like 4.9 million plus. We are almost hitting our 5 million. So I'm hoping by the end of this year, 2021, we will hit the 5 million and even beyond, exceed what we have been targeted to do.
Now, if you exceed the 5 million, what's next? Now, so what's next? What are some of the issues that you've identified in Ghana? Because I know that as a country, interestingly, since I was born, it seems that our problems keep compounding instead of asking people solutions. I mean, it is also not to say that I do not acknowledge the efforts of organizations like yourself, but it seems that every now and then, some of the solutions that we create end up creating problems in some of the communities. So, in reaching your targets, are there other challenges that you've observed or identified? Even though you mentioned that these things are resolved when they are brought to your attention because you want to engage the community leaders, are there other things that are currently not within your scope that you've identified and looking at strategies to attach or address?
Engage Now Africa, we believe that poverty can never be ended by just one program. You can't just say it's health. So I'm just doing clinic and that's it. You know, you can't just say it's adult literacy, so I'm just doing adult literacy. You can't just say awareness creation in abilism, so I'm just creating awareness. No, you can't just do that. We believe that you have to come up with multiple programs to be able to really make an impact. You know, we don't want to say that, okay, this is what we have, so that we don't limit ourselves to one particular program. That's why we have, if you look at the heal, rescue, and lift, we have multiple programs that we run under these three umbrellas or three purposes of Engagement Africa. We want to make sure that whatever, if we are trying to impact a life, we have the programs right to make sure that the impact is well felt. It is true that we are impacting life. So we don't want to just kind of do everything at a go. We start one person, one community, one village, on and on and on. So
I was going to say one down.
No, I'm so sorry. No, so that's how we do it. You know, we take one person at a time, one village at a time, one community, one region, and on and on and on.
Okay. Now let's talk about sustainability. It is one area that I am very much interested in, because I see a lot of projects go on in our communities, but then when organizations move out, sometimes you find out that either a project that was put up is turned into a white elephant. In fact, there's a story I recall when I was in school where an organization went into the north, put up a borehole, no sort of engagement to the community people. They start passing by the borehole, go back to the stream to fetch water, because there was a reason why they didn't want water close to them. The people used that time to chat, the women. But then, with the organization not having this knowledge, this cultural knowledge, they ended up putting something there, and then they went on using it. Now, in Engagement Africa, I know that you have you're abroad. You talk about extensive engagement with community leaders. How sustainable are your projects and your programs?
First of all, for a program to be sustainable, we have to engage the community.
Okay.
Communities, they have to be part of it for the program to be successful. Just like the example you gave, you put out a borehole without letting the people know you have that borehole, or why they need that borehole. You don't engage them in doing that, so you don't expect them to use it. That's not what I mean. So if you want the program to be successful, you have to engage, and not only engaging the community, let them own the program afterwards.
Yeah.
Let them know that the program belongs to them, it belongs to the organization. So it should be like a community-owned program. That is one way to sustain the program in the community. Secondly, you need to work with partners. You know, if you have partners that you are working with, you put resources together, and you are able to impact more and also to sustain the program that you are doing. So you need these two things to work together to be able to make the program very successful. So let me just cite an example. In the northern region, for instance, so we had a situation where we went out there to know what the issues are and how best we can help. We realized that there's this community. You go there and the children are just walking around. It's like they don't go to school.
Even with free school.
Yeah, even with free school, they are not in school. And then we just engaged the chief and the people around. Your children are in farms and not in school and all that. And I said, oh, they said the school is too far away. Oh, really? Is that the case? Okay. So we came back. So what do you want? And they said, oh, if you can put up a school for us, we will make sure our children go to school.
This school was a government school. Okay.
It is not, in fact, the school is not even in existence. So now they are requesting for a school from us.
Okay.
So Engagement Africa now came to the drawing board, put resources together, talk to donors, let them know that this is our challenge, this is what we have found, and we want to help these people with a school. So we are able to put up that school for them. Today, as we speak, we have about 400 children in that school. So when we build a school, the community requested for it. Definitely, they are going to make sure that they request for it again. We want to make sure that it's in operation and the children are benefiting. Secondly, because we know we don't run that educational whatever it is, we kind of turn it into the government. Okay. So we have the community being part of it, and then we turn it the management of it to the government, so that the government can send professionals in there to take care of these children. If you run this is just a typical example of how to sustain your programs, so that even when we are gone or we are no more helping the school, the government is making sure that things are run, or community is making sure that children are going to school. And then we also kind of introduce some more programs, because we also realize that most of these parents don't even know what education is all about. So they don't really care whether their children are in school or not. So we also try to engage the parents by letting them come to the Agro Classic program. Awesome. So you, mother, father, come to class. Children will also go to school. When they come, the facilitators of the literacy program will give you, the mother, a homework. Now you want to do this homework before you come tomorrow. So you have to engage it. So you see the importance of being home, doing your homework before going back to school. Now you'll be very, very curious to know exactly what is going on in your child's life. Has it been given homework? Because people just work so hard to pay school fees for their wards, but they are not engaged in the children's life. Knowing that, are they really making good use of this hard work, waking up early morning, going to the market, selling, making sure my child is in school? Are they really learning? Are they passing their papers? Are they, all these things are very important. So then this, and because maybe the parents are illiterate and they can't even read the terminal reports, how would they know how to help their child? So if we engage such programs to everyone around us, then they will know the importance of education. And then when they are investing, they will invest well. And those that are using money for funerals and clothes and all of that, they will know that, no, I have to make sure that my future is well protected, so I have to take care of my child.
With this example that you cited, have you been monitoring the community?
100%.
What's the response rate?
100%.
What's happening at the moment?
Wonderful.
All of them are getting educated.
Great. Because number one, we are here. Most of us are here. But one thing that you have to know is that if you don't, it's all about community engagement. Even if we call facilitators, we don't call facilitators as well. We make sure we find facilitators in the community, within the community. Because of language barrier, because of distance, and all of that is to factor all those that in before doing that. So we kind of call people in the community, and that's why they feel like, oh, they own the program, even though it's being run by us. Yeah, so we make sure that we get people from the field. We have field workers. We have over 400 facilitators out there all over our regions working to make sure that the programs are being monitored, they are running smoothly, and if there are any issues. And then we also go for monitoring a lot. If you come to the office every time, you might not meet me. Even though I'm the country director, I don't like sitting at one place. I want to see with my eyes what is going on. Are we really making impact? People are donating their hard-earned money to us to work on this project. Are we making good use of it? Is it making an impact in the people's life? You have to monitor it to make sure it's done. And when the people you are working with know very well that you will come around to monitor, you will come around to see what is happening, they make sure things are done right. So monitoring, like I said, is very, very important. And we don't joke with it. Make sure we monitor so well.
Now, as an organization that is healing and rescuing and lifting, what would you say has been some of the challenges you had? I'm saying this because I'm part of the Rotary family, and so we also do community work a lot. And I know what it takes. And sometimes even the barriers you move through in getting development to the people who really need it? What has been some of the challenge for you in addressing some of your programs and the needs of students that you have?
Well, you know, I would say funding it should be one, but sometimes you really, or the community really need it to be done. But unfortunately, the funds are not coming as they should. Secondly, sometimes the road to these communities are terrible. Okay, sometimes you go, you come back, and your car has to be at the workshop for God knows how many days or weeks to be fixed. You know, and you truly want to help these people. So, number one is funding. Number two is the deplorable state of our roads. Number three, I don't want to say language barrier because we don't work with the people directly. So in our case, we don't have a problem with that. We engage the people in what we do. So we don't have a problem with language barrier. And secondly, we don't even send a program to you. You tell us what you want. And if it's under our umbrella, then we will help you with it. That's what we do. We don't kind of tell you, okay, so this is what you need. If we don't have it, we'll let you know. We are sorry, we really want to help, but unfortunately, we don't operate in this aspects of what you're requesting for. Maybe we can suggest an organization that is, doing what you are requesting for. That's what kind of maybe necessitated we having a lot of programs. Engagement Africa is not as big as you think, but we are big when it comes to programs and impacts. But we have so many programs that we run and undertake to make sure that lives are being impacted, that poverty is being eradicated.
Okay. Now, in your submissions, you touched on partnership. Who are some of your partners?
Well, we have a lot of partners, but most of them are in the US. But Ghana currently, as we are partnering with United Way Ghana right now in our vocational and literacy skills, and we are also partnering with the non-formal education because they are more into the adult literacy. And we are also partnering with UNESCO Ghana. They are also kind of interested in the kind of work that we do in the education system. And also we are working on new partners. So we are working with GIZ now, but GIZ are also kind of an organization that wants to fund projects like vocational and technical and other stuff. So we are trying to see if we can partner with them to also impact more life. So these are the people, and maybe I'll say we are also partnering with the opinion leaders in the communities, yes, to make sure that the work is done right. Okay, because if we come to a community, we don't give you 100% of what we have. We want you to also be part, because if you are part of a program, you own it, and so you make it your own. But if we give you everything 100%, you feel like we are forcing it on your throat, so you might not really take care of it when we are done. We make sure that all these people are part of what we do. And when it comes to the rescue, like I said, we have the police, we have the social welfare, we have also, we have these people that are our partners that we work with when it comes to issue with trafficking.
I was going to ask how do people get to be part of this, but I already asked that directly. Let me find out. Self-reliance is one of the challenges we have in this country.
Yeah.
I mean, a lot of people are not self-reliant. And sometimes when we talk about self-reliance, people think it's just about the financial aspect. There are a lot of things that entails that. How are you ensuring that you're broadening the scope to bring or widening the net to be able to get a lot of fish in there? And if I talk about fish, I talk about people to be part of or benefit from these trainings that you're getting.
To be very honest with you, we have a lot of people that want to be part of what Engagement Africa is doing. Okay? But probably funding or partnership is the issue. So if we can help.
When you say funding or partnership,
so if I say funding, let me say, the person that is helping you with the program cannot It's not like Father Christmas. You know, that you have to have it every day. We all need help. To be very honest, I need help, you need help. In one way or the other, we all need help. But the thing is, how do we impact even though you need help, you want to help someone too. The same applies to me. I also want to help someone too.
Yeah.
Now, you can help so much, you can't help everyone. So then with the little that you have, you try to make sure that it's well impacted. And so use fewer resources to make more impact in the lives of these people. But so just so you know, I went to GIZ, and then one of the men asked me, how do you get people to come on the program? I said, well, in Africa, we don't even advertise. We don't really advertise. We just post what we do, maybe social media once in a while. But to be very honest with you, people knock on our door as if we advertise what we do. And that's because our work shows. Our work will tell you what we do. It speaks for itself. So
word of mouth is
by word of mouth, by referrals, people just keep asking and all of that. So that is how we get people to do. We have people writing to us. We have a lot of people on the waiting list that want a program or two, but we have to make sure that because we want to make an impact, we don't want to kind of do it all over, and then at the end we might not be able to finish it. We want to tackle, like I said, one person at a time, a community at a time, a village at a time, and then maybe a region at a time. So that's how we want to take it: one person, one village, one community, one district, one region at a time, so that we'll be able to make and measure our impact. Because measuring of impact is very, very important.
Okay.
Yeah.
Now, let me just remind all of you, for those of you who are joining the discussion, you can send in your comments to us here on CSR Lens. My name is Onyema Bwane. We've been having a conversation with the country director of Engage Now Africa, Cecilia Mankwa, and she's been telling us about the programs and projects of Engage Now Africa and what they have been doing so far. Their theme, heal, rescue, and lift, the programs that are under these themes, and how sustainable these projects are. For those of you who are looking at maybe being self-reliant, we would want to probably look out for ways to contact Engage Now Africa, and then I'm sure they can assist you with that. Some of you are sending some comments. I'll see if we can read those ones and then be able to send in or be part for you to be part of this comment. So I think there's a comment from someone. Is there a question or a comment? Okay. All right. So we'll read those comments when we're wrapping up on the show. But let me find out from Cecilia. What other things I'm watching? If I'm someone watching you on this program, what other things am I supposed to be expecting from Engage Now Africa?
You already seen it. It's like, I don't know what else you want to see, because we have so much on our plate already. Engage Now Africa is doing so much. We are doing medicals, we are doing literacy, we are doing awareness in ability creation, we are doing like prevention and partnership in rescuing.
On our business, what necessitated the awareness vision?
Wow, such a question. Well, we have, you know that we are very person. But these people are more kind of marginalized in society, because society kind of wrong or look at them as see they are not human or something.
Yeah.
But we kind of try to create awareness. It's more about sensitization in communities where we have such people being discriminated against.
Yeah.
So we go to the community, we bring them together, we talk to them, we let them know what the condition of that individual is, and then for them to also accept him or her, embrace him or her in the society. So that's what we do, create the awareness by letting people know that, look, they are human beings like you and I. They are just, it's just their skin color. And looking at the color, I think I almost have almost the same color, so I don't really see why we should discriminate against such people. We should love them, help them, embrace them, and treat them just like we treat any other human being. So that's what we do when we go out there, or when we have cases of people that are being discriminated against. And also, maybe, some people too, the sun is their enemy. But because of poverty, you have to go out there and work, you have to work in the sun, and it's kind of having a toll on their skin. So skin cancer and all those illnesses kind of worries them. So we try to see how best we can also get people to donate to them, or also tell them what they should do to protect themselves from the sun. Maybe wear sunglasses, maybe wear a hat, make sure you cover your skin with a long sleeve when you're out there in the sun, and make sure you use the sunscreen. It all comes to.
Was that specifically produced for them?
Oh yeah, it was. Okay. Yes, but I didn't.
Okay. Now, as we wrap up, if somebody wants to be part of any of the programs, benefit from the programs, because you talked about a lot of things, and for me, like I said, even before our conversation, the sustainability of it is very important. So if somebody has come to learn how to make his hand sanitizer, of course, this is something that will live with the person for the rest of their life or his life. Other things that you talked about, the ENA, multi-purpose disinfectants, hand wash, soap, the bacteria, the tie-and-dye materials, the hand sanitizers, and other things, the sunscreen. These are things that I see another thing at the back.
The powder, washing powder.
Those are washing powder.
Like you have to more.
Okay. Are these things on the market, or these are just done by individuals, and so it's not on a large scale?
Yeah, so these things are taught to the beneficiaries, and then they produce to sell in their local markets. Yeah, so it's not like we produce it on a large scale. Maybe in the near future, that's what we are looking at. If we can get a place where we can produce, or the learners can produce this on large scale, so that some of them will just come and take it and go and sell it in the market, or distribute it to people, so that we can generate in-country funds to be able to sustain the program. So these are some of the things we can do to keep the program running even in the near future. So we are kind of looking at, we just started with these professional skills. We want to see how it goes. But in our plans, we want to make sure that we have a place where we can manufacture or produce these things on large scales, that we can have people come for them, or we can distribute it to generate some funds to keep the program running.
All right. Okay, great. So we have a comment from Ibrahim Shalom. He says that Engage Now Africa is doing extremely good in elevating individuals and communities from poverty and help them to be self-reliant by providing healthcare, schools, clean water, and hygiene toilets for deprived communities. And he goes again to say that, thank you, Sister Cecilia, for explaining to us the good work of Engage Now Africa. Okay, great. All right, thank you, Ibrahim, for that comment there. All right, so I guess we would have to be wrapping up, and I have really enjoyed your conversation. I want to believe that we will be following the activities of Engage Now Africa. I am interested in the rescuing projects because a lot of people need to be rescued in this country. And so the targets is a bit interesting for me, and I want to say a big thank you to you for your time. Is there any other thing you would want us to know before we leave? Anything you want to leave us with that you haven't touched on?
I think I've touched on everything. The problem, maybe I'll just say this to the youth out there, people that are struggling, that they shouldn't let that get to them. They should, man up or woman up. I don't know if that's the right word to use.
We still use it.
Yeah, they should just take charge of their lives and make sure that whatever they do, they should do it from your heart. Even if you are working for someone, work for the person from your heart. And if you do so, you receive the blessings of doing the right thing. And then secondly, just try as much as you can in your own small way to help those around you. You can only help if you stand tall, then you can lift others up. So make sure that you build your foundation right, you stand well, you stand tall, and be generous with whatever you have to give. It's good to help. It's so fulfilling to do that. And I will also urge probably other organizations, like-minded organizations out there that want maybe organization like Engage Now Africa to partner with, that our doors are open for partnership, and also for individuals or organizations that also want to donate to our programs that you just mentioned. Our doors are equally open. We can come together and talk about what we want to do together, and then we can see how best we can impact more lives and eradicate poverty from our continent.
Awesome. Thank you so much. So these are the words I have picked. You should stand well and be generous. That is the only way we can all impact the communities in which we live. Thank you so much, Sia, for your time. I'm so grateful for the conversation here on Engage Now Africa and the activities. I want to believe that all of us have picked something so far in terms of how to be self-reliant and importance. For me, it's very important because staying self-reliant is one of the things that all of us need to do to be able to stand on our feet and be able to extend a supporting hand to each and every one within our communities. If we're strong, we're able to assist our families and we're able to also assist our communities as well. My name is Oniwabra. This is where we draw the curtains on this episode of CSR Lense. Same time next week, we'll be having a conversation with another organization that is doing so well in empowering women and helping them to be able to be change makers in their communities. Thank you so much for your time. Thank you for joining us. If I didn't mention your name, please forgive me. I'm sure in our next episode I'll be mentioning your name. Thanks so much to all the team that have worked on this, to my production assistant, Susan. Thank you so much for your time. Thanks for the assistance on there. And of course, the CBS team. We're grateful to all of you. Do have a good evening and enjoy the rest of your week. Bye for now.